All right. Hi, everybody. Welcome to day 2 of conference. Welcome to today's session. I know people are still signing in. We're going to run through a couple of technical things really quickly, and then we'll hand it over to presenters. So today's session's on connecting veterans to benefits and supports. So we'll be talking a little bit about, I believe, unemployment compensation and then some of the other VA benefit programs that are available. Everybody in attendance, you guys are on mute. But how you'll communicate with us, there should be a control panel on the right-hand side of your screen. If you use the questions drop down in that panel, you should be able to send in comments, questions, share your thoughts as we go through slides and stuff. The format for today will pretty much be presentations one by one, and then at the very end, we'll save about 20 minutes for Q&A and discussion. So if you guys have anything you'd like to talk about at the end, please send comments as we go through the presentations. Just so everybody knows, you guys will be receiving recordings of today's session, and you'll also be receiving the slides from today. Every morning of conference, we're sending out a follow-up email of the day before, which will include all your links and resources and stuff from the previous sessions. So check out that email tomorrow if you'd like the slides. The only other thing, at the very end of the session, a survey will pop up, which will just allow you to give us feedback on today's session. So please fill that out. That helps us create content and make edits for next year's conference. So yeah, welcome everybody again to today's session. Thank you guys, all of our speakers, for being here today. We'll go ahead and turn it over to our first speaker, and then I'll be back with you guys at the very end for our Q&A.
Thank you. Thanks so much, everyone. Sorry about that, little difficulties with the mute. Today, I'm going to talk to you today about accessing unemployment insurance benefits for veterans. You can go to the next slide. Next slide, please. So there's really 3 parts to this presentation. There's 3 kind of sets of veterans. There's recently separated veterans who separated within the last 18 months. There's veterans who have been separated from the military longer than that. And then there's a combination of veterans who may have been separated within the last 18 months, but who also had civilian employment. So I'm going to talk about all 3 of those populations. The first one is recently separated veterans. For unemployment compensation, we call that program the UCX program. And that program provides unemployment compensation benefits to eligible ex-service members to help them meet basic needs while searching for employment. The funding for the UCX program is 100% funded by the Department of Defense. The military pays for the UCX benefits dollar for dollar for every benefit paid, every dollar paid. The government pays that back to the state. And then they reimburse an account that the money gets drawn from. It's an arrangement between the federal government and state governments. The process for filing for UCX benefits, the payments are made through the state workforce agency through an agreement that they have with the Secretary of Labor to administer the program on the behalf of the federal government. The UCX program is a federal program, and the USDOL maintains oversight responsibility for that program. Next, please. Next slide. Oh, sorry. Thanks. So some of the eligibility requirements for the program are you have to have been separated within the last 18 months, and you have to file your claim with the state, and you have to have an honorable character of service. So your discharge, you have to be in good standing under honorable conditions with service. And if you're an officer, you have to have not resigned for the good of the service. The character of service is on the DD-214, and an ex-service member should have their member copy of that DD-214 available when they file the claim. Sometimes states will request the member copy be submitted as well. UCX benefits are not payable if the discharge from military service is considered dishonorable. So if you're helping veterans access benefits for UC, if they show you the DD-214 and it's a dishonorable discharge, they're not going to qualify for UCX benefits. If they have other civilian wages, they may qualify for a regular UC claim, and I'll talk about that in just a minute. Service members have to also have completed the first full term of service. They have to perform active service and been discharged or released after completing the first full term of service to which they first agreed to serve. There is one exception I'll talk about in just a second. Or if they are in the reserves, they have to have had a continuous active duty for 180 days or more. Next slide. So the exception to the first full term of service is if the individual was discharged or released before completing the first full term under one of these 4 reasons. They're called acceptable narrative reasons. So they're for the convenience of the government under an early release program, or because of a medical disqualification, pregnancy, parenthood, or any service incurred injury or disability, or because of a hardship, or because of a personality disorder or inaptitude. But for these 2 things, they have to have served at least 365 continuous days or more. The Department of Labor works with the Department of Defense to categorize the narrative separation reasons into acceptable narrative reasons. We publish that whenever there's changes to the Department of Defense separation codes. We publish a new acceptable narrative unemployment insurance program letter. The last one that was released was unemployment insurance program letter 30-20, and there's a link to that unemployment program letter in this slide. Next slide, please. The first step in eligibility is the monetary eligibility. That's funding of the claim, basically. For monetary entitlement, the WBA, or weekly benefit amount, is computed the same way it is for regular claims, based on how much earnings there were in what's called a base period. Department of Labor issues a training and employment notice with annual remuneration schedules for ex-service members' wages. So it's basically the wages are based on their rank, and each year we publish the most recent wages based on rank, and states use that remuneration schedule to populate a claim based on how much service time the person had. They populate each of the quarters with wages to fund the claim. Earnings for a leave, part-time income, military pension could reduce the weekly benefit amount just like it would in the regular state UI program. And UCX claimants can receive benefit payments for up to 26 weeks times the weekly benefit amount in most states. That does vary, and I'll talk a little bit about that at the end of the presentation when we go through a comparison of state laws. Next slide, please. So this one talks about the determination process for UCX claims. As with all claims, really, if a denial happens, the veteran is going to get a formal written decision. It's called a determination, sent to them to tell them why they were being denied. Because the states use information received directly from the military to establish or deny the establishment of the UCX claim for monetary purposes, that decision is considered final and conclusive. The ex-service member may not appeal that determination to the state. The claimant may contact the military directly to ask for reconsideration of the information provided on the DD-214 form. Reconsiderations are usually provided on a separate form, a DD-215 form. Next slide. So if they're denied, they have some appeal rights. Ex-service members, like I just said, they can't appeal the determination regarding the monetary requirements, because what monetary determinations are really is determining whether the wages are considered federal service based on that criteria I outlined earlier about character of service and first full term. If it's considered federal service, then the wages are usable. If it's not federal service, then they're not usable. And only the military can provide information on whether it's federal service. If they disagree with the information supplied from the military, they should request a reconsideration directly from the military. As I said before, it's usually returned back on an amended 214 or a DD 215. If they get that, if they bring that to you and it shows that they actually, a character service was an honorable discharge, or the narrative reason changed, or they now have showing a first full term of service was met, then the veteran can provide that to the state and they'll do a reconsideration of the claim. There's also other reasons an individual might be denied unemployment after they were actually found eligible. That could be availability for work, ability to work. If they work at a different job after they separate from the military and they separate from that job, that could result in a denial. Any kind of income that they may receive, pensions, disability, severance pay, those could affect their benefits, and also refusing work can affect their benefits. Next slide. So these next couple of slides are about just regular straight claims. These are veterans that have worked, that separated more than 18 months ago, but have other kind of employment that may qualify them for a regular claim. So same purpose, it's to give them benefits while they're trying to find another job. The difference in funding is that employers pay for the benefits of regular claims, and they do that through a payroll tax. All but 3 states, employers in all but 3 states pay this 100%. Alaska, New Jersey, and Pennsylvania require employees to pay a small portion of their pay towards unemployment. But those are the only 3 states. Otherwise, it's 100%. Benefits are 100% paid by employers. The process is the same. They file through this state unemployment agency, and the Department of Labor maintains oversight responsibility. These are state programs, they're not federal programs, so we don't dictate all the rules about the programs, but we do have broad guidelines and Social Security Act that states have to follow in order to get the administrative grant that we give states that actually allows them to pay their salaries of the people who process unemployment. Next slide, please. Eligibility for regular claims is based on state law. So you have to have earned enough money in the last 18 months to qualify for benefits, and each state has slightly different rules for that. The weekly benefit amount is determined based on the wages earned from all the employers in the base period, and the reason for separation determines the initial non-monetary eligibility. You have to be unemployed through no fault of your own, and the state law determines what that means. You also have to be able to work, available for work, and actively seeking work, but you also have to have those things for UCX claims. Next slide. This slide is talking about when you have a veteran who was separated within 18 months, but may have had within that 18 months also had civilian employment. So they combine those claims into a combined claim, basically. The first thing that they do is that they determine whether or not the military wages can be used, and that is based on the same formula for UCX and determining whether it was federal service or not. If it's federal service, then the military wages are added to the claim and they're usable. If it's not federal service, then the military wages are not added to the claim and it becomes just a regular straight unemployment compensation claim. There are some slight differences in states on how they treat last employment if it's a combined UCX and UC claim. If it's a military last employer, then they just go by the reason, whether it's federal service or not. If it's federal service, then they are generally eligible for benefits, even if they don't go into a determination. In other words, they were separated for misconduct or quit or anything else. They just go by what the military said was the reason, and if it's federal service, they're eligible. Some states, though, also adjudicate or make determinations on all the civilian employment, and they may do every single employer and delete wages if they find that they were separated for disqualifying reasons under state law, or they may just charge that, not charge that employer, but still pay benefits. So every state has a different rule for how they handle non-military service wages. Still have to be available, actively seeking work for these claims as well. Next slide. So here's where we're really going to get into sort of the meat of the presentation. That was sort of giving you a general overview. There are three main resources here that I wanted to go into. The first is a comparison of state unemployment laws. We do this every year. The U.S. Department of Labor does an updated version of this every year. The most recent one right now is 2020, and it is located at this link, and I'm going to take you there in just a second. The second is called Service Locator for UC Benefits, and this link actually links to all the state websites for filing unemployment, and they all have the application stuff. They have general rules about unemployment in their state, and they have frequently asked questions. They may have updates for things, so I'll show you that website. And then this final resource is a resource for transitioning service members, veterans, and military spouses. And this is a really fantastic resource for helping veterans find work. And it's just, I'll show you, it's really a great resource. Part of unemployment is it's income support while they're transitioning to find work. And we work very closely, states work very closely with their workforce sides to try to get people who are on unemployment jobs. So this is a really great resource that you as providers or helpers to helping veterans access benefits, this is probably a really good resource for you to provide for them to find work or find training or find lots of other things. It also has some information about military spouses and federal jobs. And so anyway, I'll show you that in just a second. So if you can, David, give me control and I'll go to the resources now. Okay. I think, let me see, hopefully it's showing the screen. Can you guys see the screen okay? Hopefully you can. I don't see any chat that says you cannot, so, oops, it went off. Okay, so, okay, great, we can see it. So this is the first link in the resource page. This is the comparison of state unemployment laws. As you can see, it has a bunch of stuff here. And this resource compares state laws. So it's going to tell you all 50 states, the District of Columbia, the Virgin Islands, and Puerto Rico, what their laws are. It won't give you the text of the law, but on some major topics, it's going to tell you relevant information for each of those states, which might be really important for veterans to know because UCX claims are slightly different than regular claims. A veteran filing a first claim can file in any state as long as the veteran is in that state when they file. So they can choose any state in the whole country, including District of Columbia, Puerto Rico, and Virgin Islands to file their claim, their first claim. They just have to be in that state to do it. So it may be really helpful to know what each of these states, what their laws are, to know whether or not they would qualify for benefits in those states based on individual circumstances. So it's a good resource to look at everything, but I think really the two things that I thought, or three things I thought would be helpful to focus on today are monetary determinations, non-monetary determinations, and appeals. So the first one is monetary entitlement. Oh shoot, I should have not, sorry, close your eyes while I go through this. It's scrolling down. So this chapter is chapter 3, and it really talks about everything you need to know about monetary entitlements, how much your weekly award might be, what does the base period look like, what does a benefit year look like, what are the individual rights, how much would the person have to have earned in each quarter, and based on that, what their weekly benefit amount might be. So most states have a benefit year of 52 weeks. There are 2 states that don't. Arkansas has a weird benefit year where it's the last quarter, so it could be anywhere from 40 to 52 weeks. And New York has a 53-week benefit year. And the benefit year is the period of time that the claim is active. It means that a person can collect benefits anytime in that range, as long as there's still money available, as long as they haven't exhausted the maximum benefit amount. So this tells you about those base periods and what all the states have. There's 2 kinds of base periods. One is alternate base period, which some states have, which allows a person who doesn't have a long history of employment, but has recent employment, to have a base period that includes the last quarter of wages rather than the last 4 of the 5 completed quarters. And then there's one that's an extended base period that lets a person who may have been injured or have illness that prevented them from filing, they may be able to use quarters that are further than 18 months. So this section talks about what that looks like. It has methods of qualifying. It talks about the high quarters, the multiple weeks of benefits. It basically says how each state determines the qualifications, and there's a chart for each state and tells you how you qualify here. I'm going a little fast. I'm sorry. I'm trying to meet my 30 minutes. It talks about the weekly benefit amount. This is how much per week the individual would be entitled to collect, and it has the weekly benefit amounts for every state. It tells the minimum and the maximum for each state, and it also says what's the requirement for collecting that maximum. This is adjustments to weekly benefit amount. There's also a table in here that is dependence allowance. Some states pay extra money per week if you have dependents. So that also might be something worth noting for veterans. If they have many dependents, they may want to file in a state that has dependence allowance. They'll get extra money for that. Almost every state has a waiting period. It's an unpaid first week. This chart says what that waiting period is for each state. So that's important to know. This is dependence allowance. It says what states have the dependence allowance. And this talks about the maximum benefit entitlement. That's the most, that maximum benefit entitlement is basically how much will the individual have in their account, basically, to collect in that 52 weeks. And it's based on state law, but this chart says what that looks like and how they calculate it. So it will tell you what the maximum wages that are required for the maximum benefit is. So you can look through that. That also makes a difference because the higher the maximum benefit entitlement, the more money the person will be able to collect. This has the monetary entitlement of the duration. This states how long will the benefits last. So if the person collected straight through, for example, in Alaska, you have 16 to 26 weeks of benefits. So a lot of states are a straight duration, 26 weeks. Some states base it on how much you have in wages and how many quarters of wages you have. This chart tells you what that looks like. And that is pretty much it. There's some deductions, but that's a really good chapter to read. The second chapter is the non-monetary determinations. And really this is where you would want to go to determine whether or not this particular circumstances that the individual has, the veteran has, may be disqualifying. And this might be particularly important for veterans that have combined military and civilian service. So if they, for example, quit a job, it would be important to know whether or not the state denies unemployment for the reason that they quit, or maybe they would find them eligible for unemployment based on the reason they quit. This chapter goes through all of that, state by state. The final chapter here is appeals, and this goes through all of the requirements for filing appeals. What's important about this chapter is if an individual is denied benefits, they are required to be sent a notice of determination. Every notice of determination has appeal rights on it. And in those appeal rights, it has deadlines for filing the appeal, and it says where you need to file the appeal. It's really important that the service member pay attention to those deadlines. But the deadlines are also in this chapter. It says every state what the deadline is for filing an appeal. So it would be important for you to particularly know that. So next, moving on to the second link in the resources, which is the benefit finder. And it's going to look like this. And what you do basically here is you're going to click on the state. You'll select a state, and I'll just choose Pennsylvania. And here it goes through, I can't see, maybe I could do like this. It has information. Oh, what is happening here? Sorry. It has information about the state, general information about unemployment, how to file a claim, has the website for filing a claim, it has telephone numbers, has status of the claim, and it usually has updates. So most states will have at least those things. So if you have a claim and you're like, where's my money? There'll be a link to say, check the status of your claim. Sometimes they'll have certifying for benefits, electronic certification of benefits. So this is a really good resource for you to use when they come in to say, where should I file and how do I do that? Come to this link and it will tell you, each of the states tell you how to file the claim. This final link is the resources for transitioning service members and military spouses. And this is the landing page on it, but there's some military spouse, a section for military spouses. And this section here that I'm about to go to is the Veterans and Military Transition Center. And it is just a really great resource. One of the things I like about this, one of my favorite things about this is that a service member can enter their MOC code and their branch, and it will tell that service member what types of jobs have comparable skills. So if you are a mechanic that's a simple one, but say if you're an aircraft mechanic, you enter that code and it will tell you all the kinds of jobs that you possibly would qualify for with the skills that you learned in that occupation, in that branch. So that's a really cool place. It has different kinds of civilian employment. It has career options, skills, interests. It has how to get back to school, like what kinds of training programs are available, resources to help pay for school. It has job search, which is how do you do your resume, finding openings, looking at federal hiring, how do you do an interview. It has benefits and assistance. It also has unemployment here, but healthcare, housing, food, tax counseling, stress, disabled veterans. So anyway, it's a wealth of resources that I think would be really valuable for veterans for you to share with veterans. And that's basically it. I know I talked really fast. I had a lot of stuff to go through, but we'll have questions at the end. Thank you so much. How do I unshare? Okay.
Great. Thank you so much, Candace. Hi, everyone. My name is Mo Cedor. I'm the legal director at Swords to Plowshares. I'm going to be going over the benefits available to vets through the Department of Veterans Affairs. So let's get started. Next slide. So quickly, what I'm going to talk about for my 30-minute segment here, I'm going to do a quick introduction to Swords to Plowshares, which is the organization I work for, so you have some context of where I'm coming from, and then an overview of the VA and VA benefits, And then I'll start with the basic eligibility criteria, who meets the definition of a veteran at the VA. And then from there, I'm going to focus on 3 particular benefits that we primarily help folks with that we get a lot of inquiries about from vets. And that's the eligibility criteria for VA healthcare, VA service-connected disability compensation, and lastly, wartime pension, which is also commonly referred to as non-service connected pension. Next slide. So Swords to Plowshares, we're a veterans rights organization. We're based in the San Francisco Bay Area. We have offices in San Francisco and across the Bay in Oakland. We're a SSVF recipient, and we provide permanent, supportive, and transitional housing. We also have social workers on staff that do case management and counseling with vets, an employment and training unit that does job readiness, job placement, an Institute for Veteran Policy, and then in the legal services unit where I work, we're a small team of 7 lawyers and 2 support staff. We represent low-income and homeless veterans before the Department of VA in their benefits claims. And then the other practice area we do is discharge upgrades through the Department of Defense. So today I'm going to be focusing on the VA side of things. Next slide. So this might be a review for many of you. Obviously a lot of you are working with vets already, but just so we can all be on the same page, a quick overview of the structure of the Department of Veterans Affairs. It's the 2nd largest executive branch entity, second to the Department of Defense in terms of budget and number of employees. There's nearly 400,000 full-time employees as of last year, and the budget was almost $219 billion. There are 3 separate arms within VA. The Veterans Health Administration, which is in charge of running all of the hospitals and outpatient clinics at the VA. There's the Veterans Benefits Administration that dispenses all of the monetary benefits, so the disability compensation, that wartime pension benefit, GI Bill education benefits, home loans, all of that. That's through the VBA. And then with the National Cemeteries Administration, which is the smallest arm of the VA that runs all of the veteran cemeteries in the country. Next slide. So there's a 2-step inquiry in terms of when you're helping a veteran, figure out their eligibility for certain benefits at the VA. The first inquiry is, do they have veteran status? Do they meet the VA's definition of who is a veteran? And if you get through that threshold, then there are specific criteria for the particular VA benefit that the veteran is trying to obtain, whether that's healthcare, compensation, and the like. So let's start with figuring out who meets the VA's definition of veteran, who qualifies for veteran status at VA. Next slide. So the definition the VA uses is found at 38 USC 101(2). It's a person who served in the active military, naval, or air service and who was discharged or released therefrom under conditions other than dishonorable. So we have 2 clauses there. The first one is pretty straightforward. I'll go into it in a second. The second one can be a little bit more complicated depending on the person's discharge status. So let's start with the first one. Next slide. So to be a veteran at the VA, to get that veteran status, you need federal active service. So if the person served on active duty, and by that I mean somebody who served either as an enlisted person or an officer in one of the branches of the military, Army, Navy, Marine Corps, Air Force, Coast Guard, and now Space Force, that is always going to be considered active duty, and that's always going to be considered federal service. So there's no issue for those folks meeting that first criterion. For those who served in the Reserves and National Guard, it's a bit more complicated, and as those who work with vets know, it's not uncommon to be helping somebody who served in the Reserve or Guard. We've relied on those entities a lot more so in a post 9/11 world than we had previously. So the Reserves are actually a federal entity already, so that's going to be considered federal service if somebody served in the Reserves, and it's going to be considered active duty if their unit was activated or mobilized. And typically what that looks like is a deployment. For the National Guard, that's actually a state entity. The commander-in-chief of any Guard unit is going to be the governor of the state where the unit is located. But the president and his or her commander-in-chief power has the ability to activate a Guard unit under what's called Title 10 orders. And so typically, again, what that looks like is a deployment. So if you are working with somebody who served in the National Guard who deployed to Afghanistan or Iraq, that's going to be considered federal active service. But if it's somebody who served in the Guard who was deployed by who was activated by the governor of their state to go fight a forest fire, like we often have in California, that's going to just be state service and not qualify as federal active service for the purposes of getting veteran status at the VA. Okay, next slide. All right, now the second clause of that definition, you discharged or released under conditions other than dishonorable. So there are actually 6 different discharge statuses that a service member can leave the service that's going to be given to them and printed on that DD 214 document that Candace was referring to, that I'm sure most of you are familiar with. If the veteran received an honorable, general, or an uncharacterized discharge, that's usually somebody, well, I'll start with honorable in general. That's usually somebody who, has very little or no misconduct in their military record. That's an administrative separation. If they got an uncharacterized discharge, that's usually given to somebody who was discharged during boot camp or within the first few months of service. And it can be for a variety of reasons. There might have been a pre-existing physical disability or a mental health disability that precludes them from being on active duty. There could be some other reason why it just didn't work out between the military and the service member, and they were separated, and the DoD just didn't have enough to say, yes, that was honorable service or it wasn't honorable service. So they have this sort of catch-all uncharacterized discharge status for those folks. The other than honorable discharge, that's given to folks with somewhat more severe misconduct, but it doesn't require a court-martial conviction. It's still an administrative separation that's handled at the unit level. It can be given to somebody for failing a drug test one time. It can be given to somebody for failing to show up to work on time a few times, or have some, a few minor misconducts, non-judicial punishments in the record could be given in other than honorable. Somebody who went AWOL a day or two, somebody who went AWOL for a very long period of time, all of those folks could be given an OTH or other than honorable discharge. The last two, though, those bad conduct and dishonorable discharges, those are necessarily given to a service member as part of their court-martial conviction. So they have had been convicted of a violation of the UCMJ, the Uniform Code of Military Justice, and as part of their sentence in that court proceeding, they are given a bad conduct or dishonorable discharge. For our purposes, there are there's actually 3 different kinds of court-martials, but for the purposes of this, there's 2 to really be familiar with. One is special court-martials, which are your more misdemeanor level courts within the military, and then general court-martials, which are your more felony level court-martials. And so the special court-martials has the ability to discharge somebody with a bad conduct or BCD discharge, but if you got a dishonorable discharge, you necessarily were convicted from a general court-martial, which is that higher level felony level court. Okay, so why does this all matter? Next slide, please. All right, so when we're trying to figure out who's separated under other than dishonorable conditions for the purposes of veteran status to meet the definition of veteran for VA, if you have one of these green discharge statuses, that's not going to preclude you from getting benefits from the VA. You're going to be considered to have met that criterion of the definition of veteran if you got an honorable, general, or uncharacterized due to entry-level separation. If you have any in the gray or blue or red, the VA has discretion somewhat whether or not to let you in the door at the VA and grant you veteran status. And so that's if you got an uncharacterized due to void enlistment or you were dropped from the rolls, other than honorable, or a bad conduct or dishonorable. Now for the folks in the red, that's a bad conduct or a dishonorable discharge from a general court-martial conviction. The only way that those vets can get veterans benefits is if they were found to be insane at the time of the misconduct. So that's somebody with incredibly severe mental health conditions, mental health symptoms rather, at the time of the misconduct. So somebody with severe PTSD or somebody who developed a psychotic disorder in service, that's an absolute defense, and they can get benefits at the VA despite having that bad conduct or dishonorable discharge from the general court-martial. Those in the gray area, the VA has a lot more discretion about. The majority of folks in this are going to be the folks with the OTH rather than honorable discharges, and the VA gets to decide whether or not to let them in the door. All right, next slide. So I'm not going to go over all of this. This is in your slides that you'll have access to tomorrow morning when you get this in the recording. But basically, the general idea is, how does the VA make this decision for those folks in that gray area about whether or not to let them in the door? And the general rule is the VA is looking at the nature of the misconduct and the frequency of the misconduct. So if there was a crime of moral turpitude, if they were a conscientious objector, that nature of that misconduct might prevent them from getting VA benefits. But if it's a one-time drug use after 3 or 4 years of service, and that's not that bad and it wasn't that frequent, they may be found eligible. So there's a lot of discretion. There's a lot of inconsistencies, unfortunately, within the VA about who gets found to have veteran status and who doesn't. But just for your purposes, working with veterans who have what are called bad paper discharges or less than honorable discharges, know that there is a chance, perhaps, that the VA will grant them eligibility for benefits despite that discharge status. There's a lot of misconceptions about this. A lot of folks leave the service with bad paper and think there's nothing available to them at the VA. And I just want to make sure everybody leaves today knowing that that is not true. We are regularly helping folks with less than honorable discharges get service connection healthcare, the full gamut of veterans benefits available to them. So it's absolutely possible. Okay, I'll stop there, but just know that that is totally a possibility for those folks, and they could be found eligible and obtain veteran status from the VA. Okay, next slide. So really quick, just the next 2 slides, I want to talk about how it is that folks get bad paper and the vulnerability that results. And so there are a lot of studies out there showing that if the veteran has a PTSD diagnosis, that significantly increases their chance of getting a less than honorable discharge. As you can imagine, symptoms of PTSD are not that compatible with the rules and structure of military life. And so if you're having trouble sleeping, if you're having trouble regulating your mood, of course, that can lead to misconduct that could get you kicked out of the military. We did a study internally at SWORDS that found that if somebody reported military sexual trauma in service, that increased their chances of getting a less than honorable discharge by 35%. There's significant differences by branch. 1 out of every 10 Marines is given a given an other than honorable discharge. Whereas the Air Force separates a 0.5% of all of their service members with an other than honorable discharge. You're much more likely to get a general discharge from the Air Force, which would let you in the door at the VA, than the Marine Corps, which relies more heavily on those OTH discharges at separation. And then lastly, you're much more likely to have a less than honorable discharge if you're a recent era veteran, 3 times more likely than those in Vietnam era, and then 6 times more likely than World War II. So the DoD is relying on separating folks with bad paper much more heavily. And there are lots of reasons why that I could get into, lots of studies about that. But basically, it's a much more quicker, efficient way of getting folks who are non-deployable out of the unit to replace them with those who are deployable, than getting them medically separated and all the resources that they need. And as a consequence of this, a lot of these folks are excluded from the system of care at the VA, unfortunately, and for other reasons. They're at a higher rate of dying by suicide, from exhibiting suicidal ideation, 7 times more likely to be homeless than those with honorable discharges, and a much higher incarceration rate. Next slide. And there's a significant link between race and getting a bad paper discharge. So in the Air Force, for example, the stats are here, I won't read them all, but just to give you an example, in the Air Force, Black airmen are 71% more likely to face court-martial or non-judicial punishment than white airmen. In the Army, where most service members serve, Black soldiers on average are 61% more likely to face special or general court-martial compared to white service members. And so, of course, necessarily, the increased instances of getting of interfacing with the criminal justice system in the military or the non-judicial punishments are going to increase their chances of getting bad paper veterans. And as a result, if you're a white veteran, you're much more likely to get veteran status and be eligible for VA benefits than veterans of color and Black service members in particular. Okay, next slide. All right, so quick review of this. If they got an honorable or general under honorable conditions, there's not going to be an issue in terms of meeting this criteria. Then, of course, if they have federal active service, they're going to meet the definition of a veteran at the VA. The VA does not automatically review those discharges for eligibility. What happens is whenever a veteran with one of those gray or red discharge status applies for a VA benefit, that's what triggers this review to figure out if they meet the definition. The veteran can request a hearing, provide evidence, and appeal a determination that they've been found to have served dishonorably for VA purposes. And if they are successful, that establishes veteran status at the VA. That applies to all VA benefits. So if they've applied for service connection disability and they get through the character of discharge process and are given veteran status, they then have veteran status when they go apply for a home loan. Okay, next slide. All right, so we've gotten through that first inquiry, eligibility. Now let's go on to what are the criteria for entitlement to healthcare, service-connected disability compensation, and pension. Next slide. All right, so healthcare. Obviously, the VA provides comprehensive healthcare to eligible veterans. That includes medication. There's also nursing homes. The HUD-VASH program, which is the Section 8 voucher program that the VA runs, that's actually housed at VHA. And then there's other extended care benefits as well. Next slide. So who, oh, no, sorry, the next slide after that. Yeah, perfect. All right, so who gets healthcare at the VA? So of course, first step, do they have veteran status at the VA? The next is, do they have they met the minimum length in service requirement? So for folks who enlisted after September 1980, they need 24 consecutive months of active duty. For those who served before, that's only 90 days of active duty. And then the folks who served in the Guard or the Reserve, the requirement there is that they've completed their full-time order to active duty. And so what that means is that, let's say they served in the Guard and they deployed for 9 months to Afghanistan, and then they came home, and that was all that was asked of them, is to do that 9-month deployment. That's going to be considered to have met the minimum length in service requirement, even though that wasn't 24 consecutive months. They completed the time that they were called up for. Exceptions to this include that they have a service-connected disability. So you could get service connection, which I'll talk about in a minute, and get rated at 10% for ringing in your ears, tinnitus. And if you only served 4 months in the military, but you have this service-connected tinnitus, then that waives your minimum length in service requirement, and you can go get VA healthcare. Other exceptions include a hardship discharge or an early out discharge. And then in addition, something to know about eligibility at VA healthcare is the VA has a system of priority groups. The higher the priority group, that means you have a higher level service-connected disability. Certain military accolades get you into a higher priority group, like if you have a Purple Heart. And your income is also a factor in figuring out what priority group. And then at any given point, VA can serve certain priority groups. And then lastly, just to know, there are exceptions to this, in particular for healthcare. Let's say you have a veteran who has a less than honorable discharge. They may be eligible for immediately receiving mental health treatment at the VA, despite maybe not having yet established veteran status. Anybody who experienced military sexual trauma, rape, sexual assault, sexual harassment in the service, who has self-reported that, is eligible for free healthcare, again, regardless of length of service, regardless of priority group. So there are other exceptions to know about. I have a citation there on the slide for your reference. All right, next slide. Enrolling at the VA is something you can assist veterans with. There's lots of different options. The form application is called the 1010EZ. That's available on the VA's website, and you can do it in person. The veteran can go in person to enroll at a VA healthcare facility in their area. There's also the option to do it via phone. They can mail it in, and then there's also an online portal that they can apply. Next slide. All right, and then the Veterans Benefits Administration, which is that separate arm of the VA that primarily takes care of dispensing the monetary benefits that the VA provides veterans. That includes disability compensation, the GI Bill, education benefits, VOC rehab is another benefit that can pay education-related expenses, survivor benefits for those who were married or in a relationship with veterans who had service-connected disabilities, who passed away from service-related injuries, or who were on pension at the time of their death. There's also the home loan program, and then there's the life insurance. Next slide. All right, so the two main, Okay, so some of the text is missing here, but I'll fill it in. So 2 main cash benefits that we're helping folks with that we get a lot of inquiries about from vets is service-connected disability and non-service-connected pension. These are monthly tax-free monetary benefits, and if a veteran is eligible for both or entitled to both and meets the criteria for both, the VA will simply pay the one that is more valuable. So the slide there that says for veterans with current health condition, that's talking about service-connected compensation, which I'll talk about in a minute. And then we have wartime pension, which is you can think of as a financial safety net that the VA provides to low-income, either elderly or disabled veterans who served during war. So we're going to unpack all the criteria for these 2 benefits, and that'll be it from me. All right, so next slide. All right. Oh, really quickly, yes, the next few slides I wanted to discuss. So essentially, to help a veteran with a VA benefits application like service connection, or to help them through the pension application process, the VA requires that that person first be accredited with the VA's Office of General Counsel. And the reason for this is they want to protect veterans from folks who are not familiar with the process, who are not going to be able to give competent advice to a veteran in the claims process. And so the requirement is that they be accredited first. For attorneys, it's quite easy. You fill out a form and what looks like a moral character application and get that email to the VA, and you'll get an accreditation. For non-lawyers, there's a little bit more of a process there. But for those who are not accredited tuning in today, I'm going to talk about other resources of accredited people who you can refer a veteran to help them through the claims process. And then I'm going to talk about the criteria for those 2 benefits, just so you, as a non-accredited person, can be aware of what potential benefits are available to the vets that you're working with, and sort of be able to spot when they may or may not be eligible, so then you can then refer them to somebody who can help them through the claims process, or help assess for them whether they're in fact entitled to these benefits at the VA. All right, next slide. So one resource available is the VA accredited veteran service offices or organizations. There are some, this is the entire list of all the VSOs that the VA has accredited to represent veterans. Some you might be familiar with: AMVETS, American Legion, Disabled American Vets, DAV, Swords to Plowshares is one of the VSOs. So these are organizations that have local chapters all over the country, and they can help a veteran through the claims process and represent them through that. Next slide. There are also government agencies. There's state departments of Veterans Affairs that often are assisting veterans through the claims process. And in every county in the country, there is a county veteran service office that's going to have staff there who are going to be accredited and able to represent a client through the claims process. So there's a little screenshot there. There's a list on the VA's website under the VBA section of the website of accredited representatives by state. So you can use that as a resource when referring folks. And then there's also a lot of free legal assistance. Over the last 10, 15 years, there's been a huge increase of attorneys working in this area of veterans law, VA law. And so there are a lot of local legal services organizations. So I would say looking up the local legal aid or legal services organization in your area to see if there's an attorney on staff there who does veterans benefits. Stateside Legal is a great resource that has a lot of those organizations listed out by state. And then as part of law school education, typically law students are engaging in experiential learning where they are under the supervision of a clinical law professor at their school and get to practice, you know, whatever the practice area is that the clinic is focused on. And there's been a huge increase in law schools having a veterans legal clinic that are doing VA benefits work and discharge upgrade work as well. And so there's a consortium that recently was created in the last few years. Their website is there that has the list of all the different law schools that have veterans legal clinics. So that's another resource. And then lastly, there are private attorneys who, for a fee, will represent veterans in their VA benefits appeals. And there's a private bar association called NOVA. Their website is there. They have a member directory if you want to refer a veteran to an accredited attorney through them as well. All right, next slide. All right, service-connected compensation, and then I'm going to talk about pension. So service-connected compensation, some of you on the call may be very familiar, maybe recipients yourself of this benefit. It can be a very valuable monthly cash benefit paid to veterans who have a current disability today that was incurred or aggravated during their active military service. It can also qualify folks who served in the reserves or guards if they were injured on their reserve or guard weekend or drill week. They can be eligible for service connection for those injuries, though it's a bit more limited what qualifies for that. But as long as any injury happened while they were on active duty, either incurred during active duty or aggravated, that's going to qualify for service connection, and so long as it wasn't a result of a veteran's willful misconduct. So if they got a DUI and have a TBI from that, or traumatic brain injury from that TBI, that's not going to count. But if they injured their knee in a combat, during combat, if they injured their knee playing basketball, as long as it was on active duty, it doesn't matter. That's going to hopefully qualify for service-connected compensation. All right, next slide. So there are 3 elements. Of course, we got to meet the veteran status. We've already talked about that. And then the 3 elements of service connection, they need to have a current physical or mental health disability, right? So this is not a benefit for somebody who was injured 30 years ago and they're still angry about that injury, but they actually have no residuals or no disability today from it. This is not the benefit for them. So they need a current physical or mental health disability. They need to have had some incident in service that caused or aggravated that, whether that's a physical injury, an initial diagnosis for a condition, or a traumatic event that is the link to their mental health condition today. So they need that incident in service. And the nexus, what we're talking about there is there needs to be evidence that the current condition they have today stems from that event in service, as opposed to something that happened before service or something after. So those are the 3 elements of service connection. Next slide. And then there's no, this is a quick review. I'm gonna speed along, but just so you know, there's no, it's not means tested. So you could make $5 million a year and still receive service-connected disability compensation. Obviously, those aren't the clients we're helping at Source to Plowshares, but just technically speaking, that is available to them. There's no income requirement for this benefit. There's no wartime requirement, and there's no minimum length in service requirement. So they could serve 1 month, be injured, and be eligible for service connection. That's no problem at all. All right, next slide. And then to give you all a sense of what is the income that the VA pays to folks with service-related disabilities, you'll see that the disability is rated in 10% income increments, and it increases by the severity of the condition. There's a whole rating schedule that the VA uses, but if you got 10% for the ringing in your ears, that's going to pay you $144 a month. If you're 100% disabled because of a combination of physical and mental health conditions, your income could be upwards of $3,100 a month, and then there's additional supplemental income in addition to all of this as well that folks may be eligible for. Next slide. All right, and then lastly, wartime or non-service connected pension. This is that financial safety net that the VA pays to wartime veterans who are low income and who are either 100% disabled or who are 65 and older. So there's a minimum length in service requirement for eligibility for this, and they need wartime service. I'm going to talk about that in the next slide. They got to be low income and have few assets. And like I said, either 100% disabled that the VA will determine, or 65 and older. Something to note about this is if the veteran is currently receiving SSI or SSDI, that will be, they'll be presumed to be 100% disabled for VA pension purposes. In a lot of states, SSDI pays more money than wartime pension, but SSI recipients who served during wartime, who have veteran status, would be eligible for additional income with this wartime pension benefit than they receive just as an SSI recipient alone. Okay, next slide. All right, so the wartime period chart is here. You'll have these slides for your reference, but just so you know, the key people who are missing from this chart are folks who served after May 75 before August 1990. Those are going to be peacetime veterans, and then anybody who served after August of 1990 will be considered wartime. Next slide. And then this is a means tested benefit. The veteran will receive $1,146 a month. And that is the maximum amount of income that they can have. If they have a spouse, it's a little bit more, and the asset cap is $129,000. Next slide. And just to quickly give you a sense of how this works, if the veteran has no income whatsoever, then they're going to receive the maximum amount from VA pension, which again is that $1,100 a month amount. But if they have additional income, and they have unreimbursed medical expenses, that will factor in into the amount of money they'll receive from the VA. So they'll deduct any countable income that the veteran receives, and then they'll add in any unreimbursed medical expenses and factor, and all of that will be math that the VA does to figure out what the veteran's monthly award will be. Okay, so hopefully these slides will be helpful for you to have to reference, and you know, and if you have any questions, feel free to reach out to me. But that's it for me, and I'll pass it on to Lexi. Thanks, everyone.
Alrighty, and let's see. Hopefully everyone can see me and can hear me. Thank you both to Candace and Maureen for your wonderful presentations earlier, and I'm so happy to be on a panel with you. So my name is Lexi Holden. I'm a Bill Emerson National Hunger Fellow serving with the Food Research and Action Center in their SNAP and legal unit. So today I will be talking about helping homeless veterans access their SNAP benefits. And I'm so excited to share this information with you all. And I've also packed my slides full of a ton of links and information and resources. So please go back, look at them, read through things. And if you have any questions, I'll have my email at the end. You can always reach out to me. Next slide, please. Excellent. So just a little bit about FRAC. It's the leading national nonprofit organization working to eradicate poverty-related hunger and undernutrition in the United States. And next slide, and this will be a little bit of an agenda for us today. So I'm going to go over basics of food insecurity. I'm going to give you a little bit of an overview of SNAP. We're going to be debunking many common myths of SNAP. And then I'm also going to be providing you with some resources and some action items. So some things to do at the conclusion of this presentation. And keep an eye out for these icons because they'll help you see which slides are relevant to which part of the agenda. All right, next slide, please. All right, so I'm going to be using the terms hunger and food insecurity pretty interchangeably today. That's something anti-hunger advocates are often guilty of doing. I just said it now. But they are very different. So hunger, if you're on the West Coast like I am, might be the fact that it's almost lunchtime and your stomach's growling. It's, you know, everyone experiences hunger at one point or another in their lives. It's just that physical sensation of needing to eat food, whereas food insecurity is a much more persistent, it's a consistent lack of access to healthy, affordable, culturally appropriate, if it's relevant to your diet, enough food of that kind for a healthy, active life. So today we will be focusing on food insecurity, though I might slip in and say hunger. So next slide, please. All right, and now I'm going to share with you a few statistics. So I'm sharing everything from data based on 2017, as that was the most recent year for data from all of these data sets in order to compare. But there is more recent data for some of these things as well. And of course, with COVID-19, these numbers are absolutely not accurate anymore. But in 2017, the US rate of food insecurity nationally was 11.8%. Though, of course, we know that for other demographics and populations within the United States, for example, Native Americans, that rate could be as high as 25% or 1 in 4. And in some particular areas, that rate could be over 80% in a particular community. For veterans in 2017, they were slightly better off with a food insecurity rate of 8.4%, though that rate nearly quadruples, or actually more than quadruples, when you take into consideration veterans experiencing mental illness at that time. And the last number you'll notice is just a number. 40,020 is the number of homeless veterans we counted in 2017. However, the reason this is just a number, not a percentage, is because we don't have a lot of statistics on homeless populations in the United States. Social scientists, federal government agencies, people who are responsible for counting folks and providing this data oftentimes miss homeless populations. So there is a dearth of information on homeless populations. So I just want to go ahead and say, I'm sorry, it's not me, but we need to do better as a group of social scientists working to end hunger. Next slide, please. So causes of food insecurity. I want to say that food insecurity, it's so much more than just not having enough money to afford food. I mean, obviously that's the #1 cause of food insecurity. However, there are many root causes for food insecurity and they are interconnected. And some of these causes are very much they're much more pervasive in populations like homeless veterans. So of course, lack of sufficient income, that's the number one. Lack of affordable housing, lack of affordable transportation, job instability, particularly in that time between exiting military service and joining the civilian world. That's a very tumultuous time for veterans, and it can be difficult, and the highest rates of food insecurity can occur at that time. Illness and disability, whether it was incurred during military service or not, discrimination on the basis of age, gender, race, ethnicity, sexual orientation, gender orientation, all of these things. Era of service, we know that veterans who served in the Korean Vietnam War era are typically less food insecure than those serving in the Gulf War era. Level of educational attainment, of course, whether or not you were able to earn a degree, and go out into the workforce that way. That absolutely affects food insecurity. And marital status, that's not to say go out and get married because you'll no longer be food insecure, but if you are a single individual, particularly a single parent, particularly a single female parent and one of color, your rate of food insecurity is most likely statistically going to be much higher than for other folks. So there are a lot of, interconnected causes for food insecurity. And if we want to end hunger for homeless veterans, we really have to address all of these things. So next slide, please. And of course, the effects of food insecurity, it's really quite a vicious cycle, because when you don't have enough food, that leads to poorer overall health, which can lead to diabetes, anemia, depression, disability, limitations in your daily activities. An overall decreased quality of life results when you don't have enough food. And of course, if you are struggling with one of these issues every day, it can make it harder to seek employment. And then that means that you probably don't have enough income, which means you probably don't have enough to eat again. So it's really a vicious cycle. And so intervention from advocates like you is just absolutely essential to trying to break this cycle for homeless veterans. So next slide, please. All right, so this is the thing I'm actually here to talk about, and that's SNAP, or the Supplemental Nutrition Assistance Program. Now, this program was formerly known as food stamps. So if you have it in your head that SNAP is food stamps, forget it, because the programs are so different today and so much better than what they used to be. I mean, really, SNAP is a fantastic tool, and it's our nation's first line of defense against hunger. Now, you might be thinking, oh, SNAP isn't necessarily what I've heard it be called. That's absolutely right. So while SNAP is administered at the federal level by the USDA FNS, it's actually operated by states and counties. So in Washington State, for example, where I'm living, you have a Quest card. In California, they call their SNAP CalFresh. Other states call it a food assistance program. So keep an eye out for the language that your state uses, though at the federal level, it's just called SNAP. And I want to bring your attention to the word entitlement program, or I guess that's two words. So SNAP, one of the reasons why it's so successful at helping to combat hunger is because it's an entitlement program, meaning that it grows as the number of people who need it grows. So it's not like a program where there are $10 million set aside, and once people use up those $10 million, poof, the money's gone and no one else can apply. So long as there are people who need the program and people who are eligible, the funding for the program will grow. It's required to do so. So that means that, if you apply for benefits, you don't have to worry about, taking benefits away from someone else who might need it more, or worrying that, one day your benefits will be cut because the money ran out at the federal level. That's not how it works. And I do want to say that it's, again, there's a photo here of a Washington State Quest card, or electronic benefits transfer card. It's essentially like a debit card or a Visa card. And that's how your benefits are given. It's uploaded onto this card every month, and you can use it at any approved retailer for any SNAP approved item. And I want to say that 1.5 million service members and veterans do use the SNAP program. So folks are using it. We just need more folks to use it. So next slide, please. So I just want to talk, kind of brag about SNAP for a little bit more time. So like I said before, SNAP, it reduces hunger because it provides low-income individuals and households with money for food. While it's meant to be a supplemental nutrition assistance program, that's where the S in SNAP comes from, for many households and individuals, their SNAP benefits are all the money that they have in a month to be able to afford food. So it's really essential that we connect folks to these benefits, because it means that they can free up their dollars and spend it on other things like their rent, their utilities, if they have a car payment, if they need gas to get to work. If they're trying to get education or childcare, SNAP is great because it frees up money for families and households to spend their money in other ways that are, helping them out in the ways that they know they need to be helped. It also bolsters local economies. For every dollar that is spent in SNAP benefits, the GDP, or gross domestic product, actually grows by $1.79. So it's a more than 100% rate of return, which is pretty impressive, because folks, when they receive the benefits, they go to their local retailers. So it helps local economies in that way. And it also delivers assistance quickly and effectively. It doesn't take very long for folks to be connected to SNAP benefits. And if you're homeless, you can be connected even faster. So it's a really cool program, and I'm so excited to talk to you more about it today. Next slide, please. Okay, so if you'll look at this funky little Venn diagram here, so I was trying to think about how to put this presentation together and really emphasize all of the most important parts of the information. I was thinking about how to emphasize the appropriate populations. So if you're looking at this, it's showing that I'm going to be focusing on veterans who are homeless and elderly, veterans who are homeless and disabled, or veterans who are all three. Now, this is not to say that the other, intersections of the diagram or veterans generally are not qualified for SNAP. Anybody can qualify for SNAP so long as you meet the income restrictions. These are just the populations that are colored in. These are the ones that I'm really going to try and emphasize in the eligibility requirements, payouts, things like that. Because this is a panel for the National Coalition for Homeless Veterans, so you're probably helping homeless veterans in your work. So that's who I'm emphasizing today. Next slide, please. Awesome. Okay, so there are some specific definitions, though, in terms of who the United States Department of Agriculture considers elderly, disabled, or homeless. So I want to go through these definitions with you. Elderly, that's pretty simple. If you are older than 60, or if you're 60 years of age or older, you are considered elderly, which means that there are certain barriers in the SNAP application process which are a little bit lesser for you. And the same goes for individuals who are disabled. For the USDA purposes, you are disabled if you receive supplemental security income, that's SSI, or if you receive or actually Social Security Disability Insurance, or SSDI. And again, like I said, if you are elderly and or disabled, the barriers to SNAP access are a little bit lower for you. Now, the homeless definition, I think, is one of the coolest definitions, if you can think that definitions are cool for homelessness, because it's so broad. So you are considered homeless if you lack fixed and regular nighttime residence, or your primary nighttime residence is a shelter. That could be a homeless shelter. That could be a shelter for survivors of domestic violence. A welfare hotel, I know that was one of the topics for one of the other panels today. An institution, perhaps a nonprofit, is allowing you to house someone, or a temporary accommodation where you're going to be living for fewer than 90 days. That one's particularly cool. Say you've fallen on hard times and you're currently experiencing a lack of shelter, so you reach out to your Uncle Ted and say, hey, do you mind if I sleep on your couch for a couple of months? So long as it's fewer than 90 days, that counts as temporary accommodation, even if that's a family member. And also anyone sleeping in a non-traditional space. So that could be a park bench, it could be a bus stop, an overpass, any of these places which are absolutely not real shelter. So the homeless definition is so broad, and that means that we can really reach more people in need because of that. So keep those definitions in your back pockets when you're serving folks. Next slide, please. Excellent. Okay, so now a little bit on SNAP eligibility, and this is where referring back to these slides later might be very helpful because it does get a little wonky, and so I apologize for that. So if you receive supplemental security income or some sort of public assistance from a state or local government, one of the best examples of that would be TANF, or the Temporary Assistance for Needy Families. That means that you are categorically eligible to receive SNAP benefits. Otherwise, if you do not receive those things, your eligibility is means tested. And I do want to say that many states do not have asset limits for TANF or similar programs. So we'll talk a little bit more about asset limits on the next slide, please. Excellent. Okay, so if you were not categorically eligible based on the qualifications on the previous slide, that means that there's going to be some combination of these things on this slide that it's going to be looked at. So for example, gross monthly income, it has to be generally at or below 130% of the federal poverty line, though some states go up to 200%. And that includes all of your cash income, any cash assistance, SSI, unemployment insurance, if you're receiving child support. Net income, you would take your deductions, including, and I really want to emphasize this for folks, there is a homeless deduction that folks can receive in the net income when they're calculating that out. I have a link to some more information on that at the end in my resources slide, but there's a homeless deduction. So if you're working with a homeless veteran, keep that in the back of your mind. And it's very rare that a household's assets are actually taken into consideration when determining SNAP eligibility, but here are the numbers. And it's usually like what you have in your bank account. Though if you are elderly or disabled, you have a little bit higher threshold. But I do want to say that if you're disabled or elderly, you only have to pass the net income test, not the gross income test. So next slide, please. Excellent. And just for reference, I know I mentioned federal poverty level, I mentioned 130%, I said 200%. So here is the example of the federal poverty level for a household of one, 130% of the federal poverty level, and 200%. And I do want to say that when determining SNAP benefits and household size, a household is anyone that you purchase and prepare food with. So they don't have to be biologically related to you. It's not even like, oh, this is my adopted child. It could be if you have roommates and you purchase and cook your food together, that could count as a household as well. And the lower your income and the larger your household, or the more people in that household, the more benefits you receive. And so I want to show you at the bottom here real quick. So if you have one person, and pre-COVID, the max benefit that they could have received monthly was $204. However, during COVID-19, we actually saw an increase in SNAP benefits by 15%. That means that their benefit, the maximum benefit they could have received, went up to $234. Awesome. And there was also the additional $95 that were provided to folks, even if you were receiving the maximum benefit, which means that right now during COVID-19, someone could receive as much as $329 in a month. That's fantastic. So that's a lot of money to go towards groceries. Next slide, please. Oh, I'm sorry. Next slide, please. Thank you. Okay, so barriers to access. So even though SNAP is a fantastic program and it does so much good to help end hunger in the United States, not everyone who's eligible actually receives benefits. And actually in 2018, nearly 1/5 of eligible people didn't participate in SNAP. Next slide, please. So these are a few of the reasons for that. As you saw in the previous slides, it's very jargony to determine eligibility. It's very wonky. People don't necessarily know how to apply. During the pandemic, prior to the pandemic, a lot of times if you wanted to apply for SNAP benefits, you actually had to physically go into an office to apply. Thankfully, due to social distancing in the pandemic, offices were allowing remote applications either by computer or by phone. But if you don't have a computer and you don't have a phone and you don't have internet or electricity, that's not particularly useful. There are language barriers. Folks whose first language is not English have a hard time applying for SNAP. People might think that the benefits couldn't really help them, like, oh, it's not going to do much good for me. But we saw what on the previous slide, it's over $300 potentially. That's a lot of money. People need help navigating the process. Again, it's very complicated. And of course, there's a lot of misinformation around SNAP and a lot of stigma associated with it as well, even though there doesn't have to be any stigma. It's a fantastic program. If you're eligible, you are entitled. It is your right to be able to use it. So next slide, please. All right, so we are going to bust some myths really quickly. Do you need a permanent address in order to receive SNAP benefits? No, you do not. You do not need a permanent address, a regular place you live, or even a place to cook. In fact, you could even, when you're applying for SNAP benefits, if there's like perhaps a shelter that you frequent and go to very often, you could, say that that's your address and you're going to receive mail there. Just let someone there know, and that's perfectly appropriate. So you don't need a permanent address. So that means if you're homeless, you can receive SNAP benefits. Next slide, please. There's a myth that says if you are using a food bank or soup kitchen that you can't get SNAP benefits, but that is not true. You can get food from multiple sources, including SNAP, food banks, and soup kitchens. Next slide. There's a myth that says that you have to be able to provide a photo ID when applying for SNAP benefits. That's also not true. There are many ways to prove your identity. In fact, if there's someone at a shelter that you go to frequently that knows you very well, they can actually write a statement and sign it saying, hey, I know this person, they've been coming here for this many years, I can vouch for their identity. That's just one of the many ways, but you don't need a photo ID. Next slide, please. If you are not disabled or elderly, you must be currently working to continue receiving SNAP benefits after 3 months. That is not true, particularly right now during the pandemic. You are unable to find employment and you have been using SNAP benefits for 3 months, you can still keep using SNAP. You are not automatically kicked off after 3 months. And even during non-pandemic times, there are a lot of exemptions. Next slide, please. SNAP can only be used at grocery stores. That is not true. SNAP can be used at any authorized retailer. That includes farmers markets, convenience stores, and there are actually special programs in some states. California has a very robust program. I believe Illinois and Maryland are getting this program called the Restaurant Meals Program, where you are homeless, elderly, or disabled. You can actually use your SNAP benefits at local restaurants in some cases, which is great if you don't have a place to cook, because how are you going to cook your groceries, you know? You can use it at a restaurant instead. And then next slide, please. So these are some really great websites that I would like to bring to your attention. Just a couple of places that if you are going to help connect veterans to benefits, some important websites you need to visit. Know where the stores are before you connect veterans to benefits. Know where their state SNAP office is located. Being able to provide information, and that benefits checkup tool lets you see what all kinds of federal benefits they might be eligible for, so you can connect them to every possible thing. If they have kids, that might mean school meals. Maybe it's WIC, maybe it's the food distribution program on Indian reservations if they live in rural areas and SNAP isn't, particularly useful to them. There are lots of ways that you can connect benefits. And the next slide, please. When you're working with veterans, it's important to have a compelling message that encourages participation and to have it in multiple languages. The best way to convince someone who's a veteran to receive SNAP benefits is to have another veteran tell them. Again, there's a lot of stigma associated with the program, even though there doesn't need to be. And if they have, a fellow veteran telling them how great it is, that goes a lot further than, just someone like you or I telling them. You need to be able to tell them where the local SNAP office is located and how to apply. Help them through the process. Tell them where the stores are located where they can actually spend the benefits. Like, don't just give them the card and then say, see ya. You got to tell them where they can actually go get food now. And also try and help them with accessing housing, employment, mental health resources, all of those other things. There are so many benefits they could possibly qualify for. And then the last page are just some more resources. Oh, sorry, next slide, I didn't say it. These are just some more resources about the Restaurant Meals Program, SNAP for homeless individuals, the homeless shelter deduction explained, more myths and truths, and some more help for connecting seniors and veterans to SNAP. And then the very last slide, please, is my email. So if you have any questions, feel free to visit either FRAC's website, or you can also reach out to me, Lexi Holden, at lholden@frac.org. So thank you so much. And that is the conclusion of my presentation today.
Awesome, good stuff. Thank you, Lexi. And we'll invite the other two speakers back. If you guys will join us for a quick Q&A. We are going to go a couple minutes past time, you guys, so everybody in the audience, if you don't have a moment to sit past 2:30, do remember we're sending out links tomorrow morning, which will include recordings and slides. So you can go back and rewatch the Q&A. We had a couple of questions that came in, and I'm going to kind of work my way backwards just because the SNAP stuff should be fresh in everybody's mind, and then we'll go back and Maureen and then Candace, and then there's a couple that are for everybody. So I had a couple of comments about people declining SNAP benefits because of them being on a fixed income, maybe their income being too high, and them only being eligible for like $15 a month. So I'm wondering if you can go into detail on the income restrictions and how that relates to SNAP and what people might receive.
Absolutely. So I don't have like the chart memorized in my head of like how much money you make versus, how many benefits you receive. But like I said earlier, in many states, if you're making somewhere between 130 up to 200% of the federal poverty line, which I flip back in my notes, could be as much as almost $26,000 a year, you could be eligible for SNAP. Of course, SNAP benefits do increase with, more people you're feeding and the lower income you have to feed them. But still, especially right now with COVID-19 additional pandemic assistance in terms of SNAP, you're getting a 15% boost. You're getting a $95 boost. I mean, $95 is already, a huge amount of money. I don't know about for you. That's like at least 2 weeks of groceries, if not more for me personally. And that's even if you're receiving the lowest benefit. So especially right now during the pandemic and when these benefits are in place, if you have the capacity to look into it and try and apply, please do, because the benefits are probably going to be worth it, especially right now with that 15% boost and that $95 boost as well.
Right. Just to bring Candace and Maureen in on the conversation, we too get a lot of calls like this with people receiving disability and it putting them out of eligibility for housing assistance, or people receiving VA compensation for benefits related to service, I guess, and also other federal resources that makes them ineligible for other programs. So I'm wondering if you guys can go into that a little bit, I guess, like the cross eligibility, and if like right off the bat, if a veteran receives one sort of assistance, does that disqualify them for a different program?
Sure, I can start. In terms of the veterans benefits, yes, for pension, that's a means tested benefit. So if they're receiving other income or other monetary support from the Social Security Administration, that will be factored into how much money the VA will pay them. It's a dollar for dollar deduction. So if you get $900 from SSI and the max amount you can get from VA pension is $1,100, then they're just going to get the difference between that $900 and $1,100, that $200 extra dollars from the VA. For service-connected compensation, though, there's no means testing, and it's not income-based. So you can get other benefits and get on top of that service connection. Now, of course, SSI is means tested. So if you're getting SSI and then you suddenly start getting $1,700 a month from VA and service connection, you're going to get kicked off SSI. And you may not get kicked off right away. You may get kicked off in 3 years and then get stuck with an overpayment from the Social Security Administration, and vice versa with VA. So something to keep in mind when you are working with a veteran who's on a benefit that is means tested and you're trying to supplement that income, to have a conversation with them about the implications of that and the need to update SSA or VA with whatever the additional income is then at that point.
Gotcha. And then I know, Candace, yours is a little bit different because it's to supplement income where someone might be returning back to work. So is there, any interaction between that and being eligible for the other assistance programs? Would having one negate the other, or like make them ineligible for the other?
Not exactly. So it's not means tested. It doesn't matter how much you earn. If you're qualified for unemployment, you qualify. The thing that it would possibly disqualify someone from receiving unemployment is if they're not able to work, or if they have limitations on their ability to work that take them out of the labor market. So for unemployment, you have to be able and available and looking for work to qualify. So you might not qualify if you're not able to work. If you have, some states deduct from unemployment overpayments of SNAP and TANF. So if you have overpayments of those, there are some states that will take that out of your unemployment. They won't take it all, but they'll take a percentage of your unemployment to pay that back. If you have income, it's deducted from your weekly benefit amount. So if you have part-time job, what work and earnings are deducted, but generally other types of benefits are not deducted from your weekly award. So Social Security, generally most states don't deduct that from a weekly benefit amount. and some state laws vary on specific types of things that get deducted. Retirements may get deducted. Military retirements do get deducted from unemployment, but other types of retirements may not be deducted. So it's a wide variety of the things that might impact unemployment.
Gotcha. Okay. And I know you pulled up a couple of resources throughout the presentation, and so everybody's aware, again, you will receive the link so you can kind of look a little bit deeper for your state. Going back to Lexi, will you explain a little bit some of the ways that all of our attendees today can expedite the process for veterans who are homeless to receive food stamps or SNAP?
So the process, if you are working with someone who is currently homeless, the process is already a little bit expedited. So in many cases, you can receive benefits. I think it's either under 1 week or under 2 weeks. I'll have to double check on that. So if there's someone in the audience who would like to follow up with me on that, I can provide you links to the information on that. But so if you're working with homeless veterans, it's already a little bit expedited because the USDA recognizes that they are in like a very critical stage where they don't have shelter, they don't have food, they don't have any way to store food, so they're probably very much, you know, going from meal to meal, fighting to find food. So it's already a little bit expedited.
Gotcha. Okay. And then Maureen, we had a question that was, can you expound on the incurred versus aggravated requirement for service-connected pension, specifically if illness or condition was aggravated to qualify?
Sure. So typically, the theory of service connection, that's called direct service connection. What we're talking about there is there was an initial diagnosis on active duty for example, Hep C or HIV or something like that, that the client, it's a chronic condition or the client still has residuals today from that initial diagnosis on active duty. A physical injury, you know, the VA is going to need evidence of that physical injury. It's typically medical evidence that they got treatment for that knee problem, that back problem, an exit separation exam that documents that during service. So something happening on active duty. The other theory of service connection that I spoke about was aggravation. What we're talking about there is a client has a pre-existing medical condition that is perhaps marked on their entrance medical exam, but it's not so severe that it precluded them from enlisting or serving. But then something happens on active duty that aggravates it. So an example would be they had a football injury in high school, they hurt their left knee, and then they deployed and there was an IED explosion and their left and right knee were both injured as a result of that. And now they have left and right knee problems today. The veteran will not be afforded what the VA calls the presumption of soundness when it comes to the left knee injury. And what the veteran would need to prove is that that left knee injury, that it was aggravated beyond the normal course that that injury would have taken without the incident on active duty. Now, in the case I just gave of an IED explosion, that probably wouldn't be too hard to prove, right? Like they were doing fine, they served a full year, nothing wrong with their left knee, and then this very, you know, intense physical injury happened, and now they have a left knee problem. That's probably going to be fine, but that's an example of aggravation. Whereas in that hypothetical, the right knee, which was not mentioned on the entrance medical exam, is not a pre-existing. That would just be a direct service connection claim that they now have a right knee problem that began on active duty. Hopefully that clears it up. There are other theories of service connection as well. I won't get into all of them. There's 5 different ones, but those are the 2 key ones: direct service connection and aggravation. Another one just to be aware of is secondary service connection, where you have a client perhaps who has that left knee injury from service that's already service connected. As a result, they've spent the last 5 years putting more weight on their right leg to overcompensate. And now they have strain in their hip and their right knee as a result of that. Both of those injuries can be service connected secondarily to the existing left knee service connected injury, even though those both arose post active duty. So that's another way to get service connection.
Gotcha. Okay. Yeah, that clarifies it. I think one other question that came up was, why is there such a big jump between 90% and 100% service connected disability?
Yeah, That's interesting that they caught that. Yes, it is very odd. There's sort of a linear progression for all of them, and then suddenly it nearly doubles between 90 and 100. Why is that? I guess I don't, I would say probably the policy reason from the VA is that if you're at 100%, the idea is that you are unable to work, you're completely disabled. That's not necessarily true. You can certainly be 100% service connected and work full time, but I think that's probably the thinking behind it. And if somebody is 90% service connected and they are unable to work because of their service connected conditions, whether that's a mental health, physical, or a combination of the two, there is another benefit that the VA pays called individual unemployability that will keep them at that scheduler 90% rating because that's an accurate reflection of their disability. But the VA, recognizing that that causes unemployability for them, will pay them at that 100% level. So we're often helping folks who come to us at that 70, 80, 90% level, assessing them for like, does this impact your ability to work? And if it does, and we can prove it, then trying to get them on that IU benefit that's going to pay them that $31 plus $100 a month benefit. But yeah, no, it's weird, and I don't know the answer to why the VA does it, why there's such a huge jump between the two, but it is notable.
Gotcha. Okay. And then one for Candace. Do you have to be actively looking for employment while receiving UCX the same way you must for regular unemployment?
Yes.
Yes.
Yeah. All states, it's a federal requirement. Work search is a federal requirement now, so all states require you to look for it. The extent of the documentation that's required by varies by state, but yeah, it is a requirement.
Awesome. All right. Well, I think we got to most of the questions. Thank you guys for being available a couple minutes after session. I'm going to go ahead and let everybody go. You guys reach out to our speakers today if you have any follow-up questions. And also you can reach out to me at NCHB if you need any, connecting or any further information that we don't provide in the slides or recordings. Thank you guys for being available for the session and all the great information you shared. And yeah, we appreciate you all. You guys have a good afternoon.
Thank you. Thanks for inviting us. Goodbye.
Thank you.
Thank
Bye.
you.